You're watching Cetome TV. Knowledge is power.
I'm sure many of you have heard of castration-resistant prostate cancer, hormone resistant. And basically what happens is when, and this is really a rough way of, can you go back?
Yeah, yes, sorry about that.
This is something that I'm not crazy about in the treatment of prostate cancer in standard care. Is a lot is put on the PSA levels, and more importantly, the time period that the PSA levels double. So if your PSA level doubles within a certain time period, then they consider you somewhat castration resistant. And they say, oh, you're not going to respond to either ADT or AR antagonists. And therefore, we're just going to give you chemotherapy. So the benefit of AR antagonists is that they bind the androgen receptor and prevent testosterone from binding it. However, what can happen over time is the androgen receptor can develop mutations in it. So it changes its conformation. And now all of a sudden, these androgen receptor antagonists can't bind onto it because it has a different binding shape. And therefore, and also what can happen is these androgen receptors can get mutated, so they don't need testosterone to get turned on. And so they have what's called constitutive signaling. And so that's one of the things that causes aggressive disease and causes treatment resistance and castration resistance. There is a new drug that I really like that's just in the approval process. In fact, it's available now, I believe, in Canada. It's called darolutamide. You've really got to push for it. I know many Canadians have been on it so far, but a lot of doctors, when you ask them about it, they just, oh, well, I don't know, they're not quite where it is. You want to push for darolutamide if you have metastatic prostate cancer. The reason is one of the problems, and this is a significant problem why doctors don't like to use AR antagonists right away, is because they do have some serious side effects. And one of those side effects is that they enter the central nervous system, which is the brain and the spinal cord and so on, and they cause problems. And some of the problems can be insomnia, they can be irritability, they can cause strokes in certain cases. So a lot of doctors like to put off AR antagonists for a long period of time before giving them. And that's a problem because they're very beneficial and they can significantly increase survival rates and reduce the spread. And you want to reduce the spread of cancer as early as possible. So darolutamide is a new generation AR antagonist, and it has limited penetration of the blood-brain barrier. So it doesn't have all of these other side effects. It also works against the androgen receptors that have mutations and have changed conformation because it binds a different area of the androgen receptor than the previously designed AR antagonists. So it really is a great new drug, doesn't have the adverse side effects, works for castration-resistant prostate cancers, and works against mutations in the androgen receptor. So that's the golden drug that you want to look for if you're going to be taking an androgen receptor.
Thank you for watching Cetome TV. Subscribe below and stay informed.